You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Dr. Katherine Saunders, who's the co-founder of Intellihealth. Welcome to the show, Dr. Saunders.
Thank you, Dr. Mooney. Thank you so much for having me. I'm excited to be here.
It is wonderful to have you here. So I always like to start off every episode by having my guest give the audience a little bit of information about your background and what you've been innovating these days.
Sure, happy to elaborate. My background is that I'm a physician. I initially trained in internal medicine, and during my internal medicine training, I was really just struck by how many of my patients were diagnosed with weight-related health complications because of their overweight or obesity. And in my medical training, I had really had very little education in what obesity was and how it affected health and most importantly, how to treat it. And so I did a fellowship in obesity medicine at Weill Cornell Medicine with Dr. Louis Aroney, who is one of the pioneers of this field of obesity medicine. And I learned everything about what obesity was, why, it's a disease, how to evaluate people with obesity, how to treat obesity, both with lifestyle intervention and with medications, so medical management of obesity. And then I joined the faculty at Weill Cornell, where I've been practicing now for many years. A few years ago, my husband, who is more on the entrepreneurial side, and I teamed up with Dr. Aroney to start our company called Intellihealth, which was based on Dr. Aroney's predecessor company called BMIQ. And our mission is really to scale and democratize access to exactly the kind of medicine we do. So effective and compassionate and comprehensive obesity medicine.
So it's such a great founder story, but when I think about obesity, it's such a complex, kind of stigmatized industry that really people have been trying to solve or change in a positive way for decades. So what is it that you all are doing differently that's going to make a difference?
Yeah, you're absolutely right, Dr. Mooney. It is incredibly complex, and there's so many different things that we need to consider in terms of even just talking about obesity. So much bias, so much stigma, so much misunderstanding, such a lack of understanding. So some of this is public health, some of this is advocacy, just really getting the word out there that obesity isn't just a lifestyle problem. This is actually a disease that for most people requires medical management. Our goal, as I mentioned, is really to scale and democratize access to obesity treatment. So when we initially started, it was a software company. So we have software called Evolve that is designed to train any healthcare provider to understand what they need to know about obesity and how to treat it, and give them all of the support they need to practice really compassionate, individualized, comprehensive care of obesity. And then on the patient side, to give them an online program. And now we actually have an app that launched recently to give them all the support they need in their journey to lose weight, and then more importantly, to sustain that weight loss long term. So the software is what we initially focused on, talking about challenges, because of the pandemic, which we had touched on before we started talking on the podcast. Trying to speak with health systems about anything other than COVID during the pandemic was definitely challenging. And many health systems don't have obesity on their roadmap. And, there are some places that have obesity centers or weight management centers, and they've been much more receptive. And some of them, we've been working with. But, when institutions just don't have obesity on their roadmap, it's very hard to get into that. We also started to get more and more requests to just really provide the medicine, provide the comprehensive care ourselves, since we're, some of the leading experts in this field of medicine. And so about a year ago, we decided to develop an affiliated clinical services line that we're calling Flyte, FLYTE, and that's been very exciting to launch. So now, not only can we work with customers with our software if they have providers who can use it, but we can also be the providers and work with self-insured organizations or employer populations, and so that's been really exciting to transition our business model sort of to be a much more kind of full service solution to obesity.
So I want to pause for just a second and talk about, just the idea of the early stage company that's really, and innovators who are trying to identify what is the business problem that they're going to solve going forward for the market. And what you just described is something that I hear really often, where innovators have a problem that they're really passionate about, that they want to solve, that they really feel like would be valuable to the health system, but it's not on the health system's priority roadmap, right? And there's this disconnect. And so I love that you guys were able to kind of leverage the pandemic to probably identify that much more quickly than you would have if you didn't have the pandemic happening, and then to be able to pivot. Because so often I see innovators that, not necessarily during the pandemic, but just end up spending years trying to persuade someone in the healthcare, in the hospital system, that their problem that they want to help solve should be on their roadmap, instead of trying to figure out a way to be able to position it to people that are actually looking to solve that problem right now.
Yes, those are excellent points, and we've lived a good deal of that. The pandemic, in a very strange way, has obviously been extremely challenging and devastating for so many. But for some aspects of healthcare, it's actually been helpful in that the forced transition to telemedicine is something that wouldn't have happened otherwise. And telemedicine is just such an incredible tool to really democratize access to populations that are underserved. So for us, being able to do what we do through telemedicine, and have widespread adoption of telemedicine, that's the first thing that came out of the pandemic that's been incredibly helpful. The second thing is really just the focus on obesity. Obesity is associated with worse cases of COVID and death because of COVID. So very early on in the pandemic, it was recognized as a big risk factor. So the focus on obesity and the focus on telemedicine have both been extremely helpful for us in a strange way.
Well, and just to even think about, maybe some of the folks that either already struggled with weight management or really didn't, but started to, just because of the more sedimentary lives that we've been living through the pandemic. You always hear that saying, the freshman 15, right? The people that go off to college and they gain 15 pounds. And I think, we've heard a lot about the COVID-19, the 19 pounds that you've gained over the last 2 years during COVID, and really being able to need programs to be able to, change that.
Exactly. We actually did a study looking at our data. We sent a survey to over 1,000 of our patients at Weill Cornell. And we did find that our patients who are medically managed for their weight, as you would expect, actually did fare better during the pandemic. So didn't gain as much weight as other people. And one of the most protective risk factors we saw, or not risk factors, one of the most protective factors we saw was patients who exercised did better than patients who did not exercise during the pandemic, which we see so much. Even now, so many people working from home, everyone is so sedentary. So it's easier to gain weight, and it can be harder to lose weight when you're very sedentary.
Yeah, absolutely. So I want to go back to the business model, right? Where it sounds like initially you were really B2B focused, and it sounds like you could still be B2B focused. Do you also have, or B2B to C, do you have any direct to consumer component of your business model? And if so, what does that look like?
Great question. We do not right now. feel that we will be more impactful if we can really power different groups to kind of take this on and do it themselves. So that's why initially we thought we could do this through software, and we still absolutely have our software business. We're working with some major academic institutions throughout the country. We're working with part of the VA. We're working with Hospital Corporation of America with our software predominantly. But then in terms of our clinical services line, we are more excited at this point about the idea of working with groups. So different unions, different employer groups. And so that we feel like will make more sense in terms of our business model, but we may, at some point in some capacity do a bit of direct to consumer. It's just such a different business model that's not our focus right now.
So that could be one of the major differences, but just what do you think about something that's been in the news over the last couple of months with Noom, who is a weight management tool that has raised over $500 million in venture capital, and then just laid off, I think, at least a quarter, if not a half of their workforce just recently. Kind of just speak to what you think is happening in the marketplace from their perspective, and then how do you think that that's going to be different than what you guys are doing?
Great question. So we see ourselves as very, very, very complementary to any sort of lifestyle approach. So Noom is more of a behavioral program. We are complementary to a behavioral program in that when that doesn't work for people, and unfortunately for the majority of people who have obesity, not just people who are trying to lose 5 pounds, lose 10 pounds, but people who actually have obesity. If you look at the numbers of any studies of lifestyle interventions, it's really a minority of people who are able to lose weight and keep it off from lifestyle alone. So those are the people who we see who've lost and gained and lost and gained. And, maybe Noom was one of the many ways they tried to lose weight. But at the point where they come to see us, nothing is working, and, they are really struggling with their weight, and they're very appropriate for medical management. So different things work for different people. I have plenty of patients who absolutely love Noom, and they do Noom, in concert with what we're doing medically. But yeah, it's one lifestyle approach of many lifestyle approaches kind of in the wellness space. I would say they're more wellness and we're more in the medical space.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So, I was on a podcast show as a guest the other day, and someone brought up the comment and question about the term obesity, and people advocating to have that term excluded from schools, of schools that were protesting to not allow students to really talk about the word obesity because of all the negative stigma around it, and just kind of prompted a really rich dialogue. And, my perspective was, gosh, this is a true medical condition. It would be like, let's not say cancer, or let's not say any other medical condition. How unfair is that to the folks that actually have this disease, as you describe it? What do you think is happening, and what are your thoughts about, changing the language around this?
Great question. There's a big push in our industry to use what we call person first language. If you look at an
Yep.
organization like the Obesity Action Coalition, they have very good information that's available to the public about this. So just as we would never talk about people who have diabetes or cancer as diabetic people or cancerous patients or depressive patients, because the disease doesn't define the person, we talk about patient
Mhm.
first language where we say individuals or people with obesity. And every time I'm interviewed for any kind of story that's being written, I always explain to the reporters that we prefer that they use person first language. So I think that's one big component of it, just the way we talk about this. And then, personally, when I talk to my patients, and I think many providers, many of my colleagues in this field, we generally use a term, excess weight or weight instead of obesity. But the name of the specialty is obesity medicine. And when we talk about this scientifically, and when we're talking with other providers, exactly, it's the name of the disease. Obesity is the name of the disease, but excess weight is generally pretty accepted for the way we talk to patients about it. And different people are really different. Some people find the word obesity to be very offensive, and some people don't mind it at all. And without knowing where people are coming from, I find it just safer and more compassionate and empathetic to say excess weight or weight.
Yeah, I agree. That makes so much sense. So one of the other things that I wanted to ask you about was I got an email a couple of months ago from Health, HLTH, about their conference that's coming up in the fall and how they were starting up a new stage called Well by Health. And it's really, from my perspective, the first time that I'm seeing a healthcare conference entity really take such a strong approach or strong step in integrating both wellness into healthcare. So they're kind of more integrating the conversation about the power of fitness and nutrition and mental, like mindfulness, categories that have really been siloed from the healthcare industry, even though we know that they are very much interrelated. And so, my thoughts are, is it's about time that we're starting to integrate that. What do you think about that? What's your perspective?
I think that's great. I agree with you. The more we can focus on people's wellness, and that definitely includes dietary strategies and physical activity and behavioral change. So everything that we talk about in our field, sort of as lifestyle modifications or lifestyle interventions, that's wonderful. And the key thing in this area is that different things work for different people. And so the more options we have, the more we have this in every single way. Different people will figure out something that works for them, and that really will impact every aspect of their life. We're absolutely sort of part of wellness, but again, we're a little bit separate and complementary to wellness because we're much more on the medical side. So if someone wants to lose some weight and diet and exercise work, that's wonderful. And I'm very supportive of that. Unfortunately, the people who we see as our patients are people for whom they just haven't had as much success with lifestyle. So we're complementary, but a huge part of what we do, really the cornerstone, is still lifestyle in conjunction with our medical management.
And I think that's really common. I think that we've really tend to kind of separate medical and healthcare and separate wellness. And, there's all these competing views of which one's more important and what role each one of them play. And I love what you just said about, different pathways working for different people. And then really this just more of an integrative approach, that we're seeing grow and expand. So,
Yeah.
what are some of the key decisions, kind of as you look back from the starting point of co-founding Intellihealth and this, journey that you've had? What are some of those key commercialization decisions that you have made that you think that have led to some of the successes that you guys are experiencing so far?
Yeah, great question. So again, we were so excited about the idea of really being a software company when we started. And then the big decision to develop our affiliated clinical services line has been great. It's just so exciting for us now to offer really a full spectrum solution to what we're doing, because it's so needed. Many potential customers just don't have their own healthcare providers to use software. They really need much more than that. So that was probably the most important factor. We also recently launched our app a few months ago, which was very exciting. Up until then, we had an online platform that was mobile friendly, but having an actual app has really taken things to the next level. We are also working on what we call subspecialty programs. So talking about commercialization and sort of different opportunities for collaboration. The first one that we've been developing is a women's health program. So looking at menopause, looking at pregnancy, looking at different women's stages of life and conditions that affect women, and how they overlap with weight, so that people who have overweight and obesity who are on our program just have much more support in those areas and can be part of these actual programs. And then providers have a much better understanding of what their patients are going through and how to help people who are in these situations, bring them through these programs and just be very educated and treat their weight in a way that's very focused on their other conditions. We're also doing a diabetes program, a bariatric surgery program, a fatty liver program. There are so many. There are actually over 200 different weight-related health conditions. And so we've been excited about being able to focus on, subspecialties and different populations who would really benefit from kind of more support that's in their specific area.
So as you're kind of thinking through these 200, health conditions that are associated with obesity, how are you prioritizing? What are some of those subspecialties that you are going to be deploying in your growth strategy going forward?
So it really depends on potential partnerships that we have, and what we're interested in and where we think, the most high yield areas are.
Sure.
Diabetes, type 2 diabetes, obviously, there's a huge overlap with obesity. So that was one of our first programs that we were developing. Same thing with bariatric surgery. In order for a bariatric surgery practice to be considered, a center of excellence, they need to have a medical weight component. So we're able to kind of fulfill that with the program that we have. And then just for me personally, I was really excited about, launching a women's health program. I mean, if you look at pregnancy, how many women have not had any sort of weight issue related to pregnancy? Nobody. Maybe some people, but there really just isn't much out there for how to help people manage weight, in the different stages, like trying to conceive, during pregnancy, postpartum, talking about infertility, how much weight can be gained during those phases. So for me, that was just such an unmet need. And it's something that we do in our practice all the time. And even though there isn't so much data in this area, because we can't do, randomized controlled trials on women who are pregnant in ways that would be interesting, right. But it's really sort of more our expert opinion and, just pulling together what's out there and putting it together in a way that's going to be really supportive to patients and to providers.
The women's health trend is something that I'm excited about, obviously being a female as well. And just, I think that there are so many women's health issues, like you just indicated, that are overlooked. And it's nice to see, whether they're female entrepreneurs or not, but that more of these issues are being explored and invested in. I think that a big part of why we don't have as much happening in women's health is because a lot of times those aren't getting funded. Those are often, I think, female founders that really struggle with raising capital. It's happening, but statistically, it's not. It's more difficult for women to raise money than it is for men and their counterparts for a variety of reasons. That's a whole nother episode, right?
Yeah.
It's really great to see you guys investing in more women's health issues.
Yes, I couldn't agree more. And it is much more challenging, but despite the challenges, it's been very exciting to see how many new companies are popping up in women's health. So specifically around menopause, specifically around pregnancy. So we're viewing this as, these are all opportunities for us to collaborate. So we're excited about, where this will take us.
Well, and I think female consumers are excited about these issues and problems being solved and addressed. And so they're, I think as a whole, even just consumers are excited to even be a part of that movement, even if they're not in healthcare, because they've, have such personal experience with these issues, willing to invest and willing to, purchase some of these solutions directly. It's very interesting to see what's going to happen as this continues to unfold.
Agree. We are very excited about this.
So, what other insights or advice would you have to share with fellow entrepreneurs that are in our audience today that are maybe ahead of you, maybe just behind you as well in this commercialization journey?
Great question. I would say that, obviously being entrepreneurial is extremely challenging, extremely challenging, maybe more so for me personally than medicine. I feel like at a certain point with medicine, you feel very, very comfortable with what we do day in and day out. But this is something for me that I had never dabbled in at all. And it's hard. There's so many ups and downs. It's very unpredictable. It's a lot of hard work. It's just really challenging in so many ways. So I would say, especially for women who have other challenges, particularly with family, perhaps, just having a lot of support is really important. So you had asked me before we started to talk about the Women Business Leader Group, and that's a group that I've been part of where it's been wonderful to meet other people who are going through similar challenges and women who really want to support each other. So that's just one example of one of the groups that I've been part of. But another group that I've been part of is through Weill Cornell, where I'm on faculty. We have a women founders group, and it's 12 of us who are MDs or PhDs primarily, who are working on startup companies. And it's just incredible to meet with these other very impressive women and, learn about topics that are really pertinent to being a female founder. So different groups like that, wherever they exist or whatever, wherever people have access to groups, I think the support is really invaluable.
So that is just awesome. What are some of the things that you've gotten out of these peers and colleagues? When you think back of how it's made a difference in your life, it can be something small. It doesn't even have to be anything major.
Yeah, I think just, especially among women, people's willingness to help other women has just been incredible. So whether it's just making connections, making introductions, helping in any sort of way. And then, specifically my women's founder group, talking about topics that are just incredibly helpful to what we're trying to do. So, how to negotiate and, we had one session about imposter syndrome and how it's really pervasive and how to recognize it and how to deal with it. So there are all these topics that, you might not identify or think about, but, when you have a program like this or, have conversations like this in some way, it can be so helpful to be on the same page as other people and really, figure out shared experiences and talk about advice and where to go from here.
That's wonderful. So the last question I have for you is around legacy. So we talk a lot. I like to end each episode by asking my guests about the legacy that they want to leave behind. So how do you want to be remembered, both by maybe in healthcare or outside of healthcare? When you think about the legacy that you're going to leave behind.
Oh, that's a great question. Thank you. So I would say, I'm very proud of the work that I do clinically with my patients. And it's just such an amazing opportunity to work with each individual patient and, take them from a place where they just feel like nothing is working and they've given up to really educating them about why this isn't their fault and why they have a disease and giving them hope and, figuring out what we can do about it and working through this journey together to a place where, they've lost a significant amount of weight. They're keeping keeping it off. They've improved their health. And so working with my patients, I find to be incredibly gratifying. And I will never give that part of what I do up. So that legacy to me is very exciting. And then on a bigger scale, the reason why we started the company was to take what we do in our practice with each individual patient and really scale and democratize access to exactly this kind of care. So I think, if we're even a little bit successful in scaling and democratizing, this is a huge, huge, huge problem. Obesity is really an epidemic. And if we can, help thousands of people, millions of people, I don't know how big we can eventually get, but just the ability to take this out of just my individual practice or a group of providers' individual practice and use our skill and our expertise and, technology and our whole incredible team working with us to spread it as much as we can. This is what we're really, really working towards.
That's wonderful. Everybody making a difference, making a difference in people's lives. And, that I think that trickles down to families and then communities and then society at large, one patient at a time, right?
Exactly.
So thank you so much for joining me today. I really appreciate it. And I know that our audience would have learned quite a bit from you today.
Thank you so much for having me. It's been a pleasure.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.